About age of consent, and then in the time
Stand to introduce yourself.
My name is Kenneth Taif Panda, and I'm a member of the ZYP. From what we about consent in our group, we discussed that in the times that we live in, and they have there is so much that they are getting that is not good for them. So from yesterday's meeting, I would say that we discussed that it would be better if the age of consent was like to be revised instead of like depending on the current one. Let's say, for instance, the current one which we have is 10 to 14 or 10 to 19, somewhere there. That's when somebody is like eligible for age of consent. But according to what we discussed, and it made a lot of sense if we are like to switch maybe to 8, starting from 8 going towards that. In the near future, we may going to have like kids who can be brought up in a manner that is appreciable, because there is so much that is happening in this world that we're living in. And if we don't like speculate of what is going to happen in the near future, we try like to push it to 12, somewhere there, it's going to be bad for us. It's going to be a very delicate future where we're going to have full of lawless people. But if we can make like a change, it's right now. And yeah, that's where like I can just end to say.
Thank you. Please, can we kiss our contributions? Keep it simple. Keep it simple and short. Anyone else?
All right. Good morning. My name is Gerard Mount from Southern Province. We had a very wonderful and brilliant group, and our group was action-oriented and not theoretical. So I just want to submit some of the things that or solutions that we think would help as we are discussing or rather advocating for SROH programs. So one of the things that we discussed that should be done, or rather the solution, is that we have to make sure that there is harmony in terms of laws, traditions, and the region beliefs. So those with portfolios, especially at national level, as well as the traditional leaders and the region leaders has to come, they have to come together so that they discuss and harmonize the issue to do with laws. We have standardized laws in Zambia so that we don't contradict in as much as we are dealing with sexual issues. The other thing is that as youths, we can keep on talking and talking, but if we are not action-oriented, then nothing is going to happen. So we suggested that we should regularly be submitting some informations and documents in Parliament so that they are raised as motions and get discussed. We believe that if that is done, it will be very easy for us to achieve what we are advocating for at the end of the day. The other thing that we suggested is that those well-wishers or funders should increase funding in these programs. For example, the youth-friendly spaces where we're able to discuss various issues affecting youths and adolescents. If there will be funding, it will be very easy for us to sensitize in the communities concerning sexual reproductive health and other issues concerning youths. So without going any further, let me just end here because there are a lot of things that we discussed. Thank you so much.
Thank you so much. Please, let's keep it simple and short.
Good morning, everyone. My name's Clive Zulu Chikalanga from Zambian Youth Platform. I'm going to give my contribution based on SRH, or rather sexual reproductive health. Taking the words from the ED, the Executive Director, Mr. Malambo. He talked about the rights or the health rights being made, or maybe solutions that involve the rights of young people being made or being implemented by the young people, because we're the victims at the end of the day. We're the ones who get involved in these predicaments. So I learned that at the end of the day, the young people are the ones with the solutions. So the solutions that are made from the young people are easy to implement, and they're very sustainable when it comes to development, because it's not something that's just going to be made for that particular time. It's ongoing, and it's going to be sustainable for the rest of our lives. So that's what I lay in chest today.
Thank you so much. The last two. Anyone? Ladies.
My name is Mainza Monkombwe from Eastern Province, Chipata. So yesterday, we also discussed that Zambia contributes 11% of the percentage of HIV in Africa. And then they are focusing on the eastern and the southern region, because these are the hotspots of HIV contributions. So they are bringing up a lot of projects in order to reduce the new HIV infections, so that by 2020, we can reduce and get rid of HIV. Thank you.
Thank you so much. Thank you so much. Thank you. Thank you. The last one. The last one. Thank you so much. Okay, we have a...
My name's Jade Piri. I'm from Northern Province. I would like to talk about, just as our colleague here did, age of consent. In Zambia, the age of consent for someone to get tested is, I think, 10. But from my opinion, or from what we discussed yesterday, I don't think there shouldn't be any age of consent for someone to get tested for HIV and AIDS. Because what if there's a situation whereby someone has had HIV and AIDS since they were born, and then if the age of consent for someone to get tested is 10, they're supposed to live with it from the time they were born until 10. So which means it's going to be killing them slowly. So I think there shouldn't be any age of consent for someone to get tested for HIV and AIDS. Thank you.
Thank you. Thank you. Interesting. Interesting contribution. So I'm your chairperson for today. My names are Felix Tabiso Hamayua. I fully introduced myself yesterday. I don't think I have to go through everything. Do I have to go through everything? No. Thank you so much. So before we start, allow me to call the Executive Director, Mr. Malambo, just to give his few remarks for the day. And we start our program with UNESCO. Mr. Malambo.
Good morning. Welcome back. Unfortunately, there are too many empty seats and very few people outside, so I'm kind of worried. Is it that there are people who are hangovered, tired already, or they have gone back home, they got homesick? So we're still wondering. So we'll see what time people will be coming in. Yeah, otherwise, today we have another packed day. You may recall that we didn't do a lot yesterday. There are quite a number of presentations that did not happen, so we're hoping to squeeze them in today's program. However, I think we still needed to pick what's very important. What are the most important things? Because we definitely have to drop other things. Otherwise, we have to go on till midnight for us to conclude everything on the agenda, which is not feasible, I guess. So today is that last opportunity that we have to make this particular gathering count. Otherwise, it will be one of those talk shops where we come, we talk, we have lunch, we drink a lot of water on our tables, lots of tea. We go back home, we forget it happened. We look forward to next year to come and gather again. But as ZYP, our aim is to change the narrative. We don't want to keep doing that, to talk and go. But we want to talk, take action, and continue holding people responsible, right? We hold them accountable. If they promise us something, we continue pushing. For those of you that were there last year for the Indaba, one of the key issues was the barrier in terms of access to services for young people who have disabilities, right? And key were the deaf. So we had a panel discussion, we engaged the ministry, engaged different stakeholders within that conversation. And I'm happy to report now that there's been a lot of progress. Based on what they promised last year, they've done quite a lot. There are health service providers who are being trained in sign language to be able to provide this service. In the next Global Fund budget for the country, we have resources there to train more healthcare providers in sign language so they can be able to attend to our young people who are deaf and get rid of that barrier, because they also need the services, right? It's about leaving no one behind, and also we're speaking to universal health coverage, which means we need to get rid of every barrier, every possible barrier that stops you from accessing services. So as a platform, we have even other suggestions that we've given to the ministry and other stakeholders. So you don't necessarily need to wait until you train a healthcare provider. There are other opportunities, other avenues. There are community healthcare workers that we engage throughout the year to do this work. Why not make that selection very inclusive? Include people that can actually use sign language to be part of the package. So then they're able to fill up that gap. Include young people within that particular package of healthcare, community healthcare workers. So that again, you remove the barrier. Because the healthcare workers in these facilities, in certain cases, they serve as a barrier, because most of them are aunties and uncle figures from the communities, and they're the first point of entry. When you get into the facility, they're the first people that you meet. So if you meet your neighbor who is a friend to your mom, and you're going there for an STI screening, or you're going there for family planning, are you going to do it? You turn back, or you blame it on the head. I have a headache. You get Panadol, you go back home. Nothing done. So there are a number of solutions that you can actually propose within here. So today's sessions will be centered on us coming up with specific practical solutions that we think we can also contribute in implementing as young people. I hope we understand that. So we'll have sessions where we'll have a few presentations. We'll have some groups sharing their initiatives, because we are showcasing what young people have come up with, the solutions young people are driving. So we have one that will be presented from Zimbabwe, Zvandiri. So they'll present, they'll share with us what is it that they're doing. We have another group from Zambia, Phenomenal Youth. They'll also share how they're supporting fellow young people with treatment. Those that are living with HIV and on treatment, how are they supporting them? So there will be that sharing as well. We have Youthwise Zambia from SAT that will also be sharing their model on how their platform is working and how much they're helping young people to access services easily. We have the 393 helpline. That is also another initiative, another platform, which will be shared by our colleagues from Zimbabwe, youth advocates. They'll share that. So the hope is that we interact, we exchange these ideas and see what is it that we can replicate. It could be happening in Zim, right? But is it something that we can do here? We want to see, we want to learn and see if we can domesticate that, if we can replicate it here within our own programs. So the idea is for us to exchange knowledge and see what it is that we can do. So that is one. The other one is for us to come up with our own solutions. So after lunch, we'll all go into groups to design specific solutions that we want to continue following up and holding governments accountable. I hope that is clear. So at this point, I'll hand back to the chair so we can move on to the CSE conversation. Unfortunately, the CSE conversation, we should have had quite a number of people that were supposed to be part of the panel who are not available today because of some shifts and changes in the program. We're supposed to have a bishop from the Evangelical Fellowship of Zambia. If you remember, that was, we needed them on the panel so they can also share their views around the future of CSE.
Okay, so let's just do one simple exercise. I'll try to put the mic away as I. Right, let's do it. Let's do it. Let's do it.